Good morning. This is Bill Baker at Firestorm, talking to you today from gloomy and cold Atlanta. We're glad that you've been able to join us for this webinar, co-sponsored and underwritten by the Georgia Independent School Association, GISA. We've got Candy Lau, who will be making some comments in just a few minutes. We invite you to become our Facebook friend. Firestorm Solutions is our Facebook name. You can also follow us on Twitter at Firestorm Soul, S-O-L. There is a hashtag Crisis Coach. Firestorm transforms crisis into value and empowers you to manage risks and crises. Firestorm has expertise in crisis management, critical decision support, crisis communication, crisis public relations, and consequence management. The presentation today is not complete without the accompanying oral comments and discussion. Work product that will be provided must be read in conjunction and with guidance given by your organization's personal counsel. In addition, the information given should not be interpreted as legal advice or legal opinion. We're pleased to have the Georgia Independent School Association supporting and underwriting this Crisis Coach webinar series. Today's topic is communicable illness, and it will be presented by Jim Satterfield, who is the President, Chief Operating Officer, and co-founder of Firestorm. Jim has a lot of experience in making this kind of presentations all over the country. Please go to firestorm.com. You can watch past webinars. You can register for future webinars. You can download white papers and all kinds of goodies. Do sign up for our weekly newsletter. Our moderator today from GISA is Candy Lau. She's the Vice President for Programs and Member Services and Chief Financial Officer. Candy, over to you, please.
Good morning, everyone, and welcome to this fabulous webinar series. And want to thank Firestorm and Jim Satterfield and his crew for everything they have done this past school year in presenting these, and also the workshop that they did in the fall. And we want you to take advantage of this, ask questions, and thank you, gentlemen, once again.
Thank you, gentlemen, once again for being a gold sponsor.
Well, we're glad to be with you, Candy, and we hope everyone had good meetings down at Callaway over the weekend, and as those areas were coming through. By the way, Candy, I'm always impressed when I see you with all of your titles. I think you must control the world here when I think about the Georgia Independent School Association.
Thank you, but that's not true. I'm just blessed to be able to interact and be part of a group of 160-plus schools and everything. And thank you so much, Jim. We look forward to this today.
And we thank all of you that are listening today, either live or later on recording, about what you're doing in your schools and the work that you do there and the difference that you're making in the lives of our children. I'm Jim Satterfield. I'm the president of Firestorm, and I look forward to speaking with you today. As you know, as we start out, we always talk about a quick update of what we're seeing in the news and the impacts associated with it. We're seeing lots of different things. The shootings are continuing, both in the workplace and in the school areas. Communicable illness we're having a high flu season this year, and the BioRadar's forecast is that the swine flu will return in the fall at a pandemic level. So today's topic will be very timely, focused on that. We've had the meningitis outbreaks. We've also had a mumps outbreak recently. And we've all been following the outbreak in California in the school where over 24 children developed polio-like symptoms. It's not polio, but it does cause paralysis, and it is feared that that is going to be permanent. That particular infection is very alarming in that we don't know what it is, what caused it, or what needs to be done about it. The winter storms certainly have had impacts on us, and we've clearly seen that here in the southeast as the storms have come through, and we've lost a large number of school days and had a direct impact on it. Hopefully your school came through the storms and you didn't have students sleeping there overnight, as we saw happening in Cobb County with 2,500 students trapped overnight in the schools, and you need to be thinking about the supplies that you'd want to have in place. and students that didn't get home on the bus systems until 2 or 3 in the morning or were dropped off at bus stops with no parents to pick them up. So there's a lot of things to consider when we think about how we're impacted by natural causes and natural events. We also are obviously concerned about violence in our schools, and we'll continue to talk about that on other webinars. So our goal is really to start simplifying preparedness. And as you see from the picture here, there are a lot of things that are behind our children that they're exposed to. And your plans, your preparation will make a difference. Now, I think that hopefully your school isn't pictured here in this particular shot, but when you look at it, this was not exactly state-of-the-art business strategies for combating communicable illness, how to avoid influenza's gargling daily. I know that I'm old and decrepit, but I actually think this classroom was a little even pre-me when you look at what was included in it. But the signs and symptoms are correct. As you look at that list along the left, that's what we're thinking about, because what we need to put in place to deal with a communicable illness in our environment. And it's not just thinking about the horrific pandemics. It's thinking about all of the types of things that can come through. A chickenpox outbreak in your school, or a mumps, or the meningitis, or that event in California certainly can be significant. And the symptoms that you see along the left hand are ones that we want to prepare for. But when we think about a pandemic, what does it take to rise to that level? First, you have to have a highly virulent organism, something that is going to be strong and remain in those areas. We then have to have a lack of immunity to it, to be easily susceptible to that particular virus. And then finally, it has to become transmitted from one to another. So the difference between an epidemic and a pandemic is the scope. A pandemic is literally across country, across the globe, as we're thinking about it. We could certainly have an epidemic in your town, your county, or your school, but we're looking at it on a larger basis. The number of years ago, we saw the avian flu come in, and it had a high death rate on it, but it was not easily transmitted. When the swine flu came a few years ago, it was lack of immunity, but it didn't have a high level of fatality, even though it was easily transmitted. So those are areas to be aware of. We're now seeing thousands of cases of swine flu here in the United States. That's an area that you want to, again, be aware of in the supply areas. When we think about these types of things, we think about the modes of contact and how it could be done. It could be direct contact with it. It could be indirect, getting it off of the surface. It could be droplets, or it could become airborne. When you think about each of these, those are the areas that we're going to be focused on, and to see how that infection would run. When we think about the course of an infection, first we have to assess susceptibility, and that's hard for me to talk about this morning. I guess I didn't have enough cups of coffee for it to become universal. First, that there's an incubation period of 1 to 3 days. So here, that infection can occur before symptoms are even present to be concerned about. And on average, for every person that gets sick, they will infect 2 others, hence this multiplier effect and why we see it start to spread. Viral shedding and the risk for transmission will be greatest in the first 2 days of the illness. So right at the beginning, when people are sick, that's when we need to be most concerned and careful. And as this goes, and if it develops into a pandemic, then we're looking at multiple waves, 2 or 3 waves, and this will be present over an 18 to 24-month period. If, in fact, the bioradar's forecast on the swine flu returning in the fall is correct, that will be an example of how a second wave on the swine flu is coming in and following that pattern. So when we think about it, who is at risk? You see from the CDC a listing of a variety of areas, but I'd like to direct your attention to the highlighted area in the middle. Persons between the ages of 6 months through 24 years of age. That's right where our schools are. That's right where you have the highest concern. So it's not just the elderly or the infirm. Children, young adults, pregnant women, people with chronic health conditions like asthma, diabetes, heart disease, neurologic problems, and immune suppression issues. So as we think about these areas, you're at the key critical point in this outbreak as it would come together. I wanted to share a little bit with you and then draw an analogy. SARS, as it was transmitted a number of years ago, came as a result of a flight from Hong Kong to Beijing. There was an individual who was sick on the plane, and then he proceeded to infect other people on the plane, as you see the infection starting to occur across the slide. 18 people became infected. So it's not just those on his row. He could have coughed, and that could have gone forward. He could have bumped into them in the aisle or in the area, or they could have had some direct contact area. And think about air circulation within it. But ultimately, out of those individuals, 4 people died. But when this plane landed, what happened? Well, if they were greeting family members, there were hugs and kisses. If they were greeting business associates, there were handshakes. Again, the direct transmission. Now, take it out of the airplane, and let's assume this was a classroom. Think how easily it would be spread from the desktops and the blackboards in your rooms, or the computers and access, the closeness between those areas. It would spread very, very quickly. By the way, SARS spread in Hong Kong via the elevator buttons. People would cough and then push that button, and the disease would be transmitted there. So there are things that we need to be aware of. If you look at the patterns from these pandemics, the Spanish flu in the 1918 to 1919, look at the number of deaths worldwide. Look at the fact that they were young, healthy adults. It affected the military in fighting the war. We had the Asian flu in the 50s when I was growing up, later the Hong Kong flu, and see those impacts. But when you think about this, it crossed with the circulation of money. Money was one of the key elements where people would be coughing, touching that, and then passing it across. But look at the line down below. The Spanish flu, the 1918 flu, went across the United States in 10 days. Think about transportation back in 1918. Compare that to transportation today. Think about how quickly this can accelerate and flash. That's why your monitoring is going to become so critical. So why we're concerned about this particular area is this transmission from person to person, not the chicken or the bird or the other areas that are carrying forward. It's when we look at it, it shifts over. When we have the ability to impact humans directly, that's really where the element of concern comes. Now, there are other ones that are emerging. The N7H9 is a flu that's coming out of China. We're seeing a large number of reportings there. And obviously, as we're following these events for our clients and contacts, looking at the level of information that comes out of China and the accuracy, just think about the Malaysian airplane and how all the reports have been coming around about it, how uncertain we are as we start to track these individuals. So if you look at the graph chart there, and you're all familiar with a bell graph from all those courses that you've taken in education, you'll notice that if you prepare, you can significantly lower the impact. So if you don't take away anything from this, having the flu shot, having the cleaning plans in place, having the protective, the mask or the gloves, all of those things can make a significant change. So minor interventions on your behalf can have a significant reduction in what's happening. If you're unprepared, this could run through your school, and you could literally have hundreds of young people severely ill as we go forward. So when you think about communicable illness, the ones that come to mind are listed there. We also have the dengue fever moving into the United States, the MRSA virus, the staph infections, the meningitis. We've even seen plague and tuberculosis. All of these are communicable illnesses that you need to be aware of, in addition to the seasonal flu and the childhood diseases that run through as we come together. Now, you can go to the government sites, and they track, and this was I clipped a few weeks ago, but you can see that some parts of the country at that time were higher in the influenza-like symptoms. But if you also then look, you see an uptick in some regional areas as it's been coming through with earlier in February, and I can clip the later charts, or you can go to the CDC site and look at these for yourselves. I would be concerned when you start to see the widespread coming into Georgia. Those should be trigger points for you to activate your individual plans. So when you look at the decision processes, we will again follow the same predict, plan, perform that we've used in our other webinars as we've talked about how to deal with it and going forward. So if we think about, you want to look at your policies and your procedures, and as you get started in that area, you want to get buy-in from the leadership within the school, your head of school, everyone there. Look at your planning team, how you would start to develop what your plan would be and update it. And your plan is more than a one-page document. It's got to tell people how to move and what to carry forward. You then need to do the training and then to have an active monitoring process so that you can continually identify the actions that you need to take. I recommend that you create checklists, and we'll share some samples of those with you in just a few minutes to look at, to find out, are we going to pay people if they're out sick? Are we going to refund tuition if we have to close the school? There are lots of issues to be dealt with, and filling those out and addressing them become very critical if we talk about it, an event that rises to a level of a pandemic. Now, Firestorm takes a different approach as we think about it. You want to make sure that your board of directors, your board of trustees for the school have passed motions that as a board, they're trying to support you in what you're doing in those areas. Because whether we're talking business continuity, school preparedness, workplace violence, behavioral threat risk assessments, or in this case, communicable illness or pandemic planning, this is a governance issue for your board. When we look at it, we view 3 levels that we're focused on: guarded onset, elevated onset, and severe onset. Historically, the World Health Organization has only talked about levels within a pandemic and putting you at battle stations like these old black and white movies from about ships at sea and combat and responding. We split that down to looking now more specifically at these levels at guarded, elevated, and severe. And we'll show you how that works together. But how you would monitor it, we've given you some indication of what you ought to be looking at on this particular slide. The internet and social media certainly could be a good indication. When you're starting to hear reports of students being sick or in adjoining communities, or seeing a public school or a private business closing, and then the warnings from your local health department, state, and the CDC. Now, the states produce maps, just as we saw maps of the United States. This is one out of Florida. And so if you were in a county here when this map came out that said it was at a widespread level in your county, that would be an area where you'd want to be looking at it more closely. Those where there was very little activity, then you wouldn't have an exposure. But think about, as we look at the state of Georgia and looking at the information as you plan, it would make a difference. Now, the World Health Organization used to have multiple levels of a pandemic, and their response to the swine flu caused a great negative reaction because their criteria had created a level 6 very early on when it was not even here, and they lost credibility in getting people to carry forward. So now they've just said, hey, there's interim periods, there's an alert phase, it's either a pandemic and you need to be aware of it, and then there's a transition back to normal. Well, the pandemic doesn't tell you much and doesn't give you much direction. We've broken that into an imminent stage and an onset stage. And if you look at it, the definitions it's when you see that the disease is mutated, where there is sustained human-to-human transmission, that's an area where you need to start becoming aware. So if you're looking for what should I monitor, what should a trigger be for me, when you're seeing reports about an illness that has an impact globally, and you see that there are documented cases that it's human-to-human, that becomes a point where you would want to start to move in activating your plans. Now, when it starts coming near you, you'll see that guarded onset, efficient and sustained human-to-human transmission, low risk of impact to the company or school, critical operations, and employees. And elevated is the next level up. Person-to-person cases presented in geographic proximity to your school location. Now, is that within our state? Is it within your county? You make that determination as you carry forward. Clearly, if it's in the county and it's in your particular area, then I think you probably are at that severe level, which is the next one. Person-to-person cases in geographic proximity to the school. high risk for dramatic reduction in the ability to sustain levels of service for critical company functions, or in your case, school functions. So you can't be at battle stations from the very first awareness of human to human. But as you see it enter the United States and start to spread, remember the Spanish flu went across the United States in a mere 10 days in 1918. Identifying and monitoring will be the key triggers for you to activate your plans. Now, when you do the planning, there's a lot to think about, and that's communicating. And communicating on all levels about your cleaning policy, hygiene, social distancing, telework. You may need to have students work from home and have teachers communicate with them for a period of time. Traveling policies. Do you have anybody who are taking an educational trip? Is there a basketball game or a football game or a sports game that people are coming together? And even visitor policies allowing them to come into the school. So you would want to then think about what is the personal protection equipment that you need to have in place, and whether they're the N95 mask or the gloves or the other elements that would be there, the cleaning types of supplies that you need to have in place. You'd want to start looking at that now before there's a shortage. Just think about with the winter storms when you went to the grocery store and there was no bread or milk or eggs. These are the types of things that we want to start planning for now and including in it. So looking at your plans, looking at your policies, making sure you've got them done, and now looking at getting your supplies. Now, as we move forward, you really want to be building communications around what you're going to be focusing on so that there's trust associated with you and what your school is carrying forward. You want to start creating those letters now and posters that you would have up and talking about what you need to do, the washing of hands, don't sharing paper towels and those elements. And after you've done that, then you really want to move into the perform phase, training and testing of your plans, looking at your policies on absenteeism, bereavement, quarantine, emergency closings. And you may want to change some of your strategies in that imminent phase that we talked about earlier. How do you want to look at those? And carrying it even further and looking at each one of these areas as individuals will be forced to think about it. Also, source of funds. Your teachers may, if you're closing classes, you may not be paying them at this point. Where are they going to get their money from? How are they going to access it? And are you going to do reductions in force or layoffs associated with it? I know these all sound like extreme measures, but again, if it rises to the levels that potentially a pandemic can, it's going to be the types of decisions that you need to make. Making those decisions today, before you're in a pandemic, before it's risen to this level, become absolutely critical. You don't want to wait until it reaches that level of intensity. The legal issues, the American Disabilities Act, OSHA, the Safe Environment, Family Medical Leave. If you have union that can make a difference. And also there's going to be confidentiality. You don't want to be running around and saying Mary has the swine flu associated with it. So you've got specific information that you want to be very careful in how you handle it. Also looking at insurance coverages. Do you have business interruption insurance for your school? If you have to refund tuition, will you have the opportunity to deal with that? If this comes in that you have a teacher that's sick, is it their health policy or is it your workers' compensation policy that's responding? When you think about that, if the teacher got sick at school as a result of contact with the students, which policy is going to respond makes a big difference as you think of those issues. So I would encourage you to speak with your insurance broker and understanding how those two policies interplay in light of a communicable illness and a pandemic. The time to find that out is today instead of in the middle of an event as it's coming through. Looking at your critical vendors, as we've said in many of the other webinars, supply chain failure is one of the most critical aspects. So look at your food suppliers. Look at if you have someone supplying security to you within your school, doing the cleaning. Do they have plans in place? Is there a force majeure clause that states they're not going to operate? And what are the changes in your cleaning instructions for your maintenance and cleaning people in light of a communicable illness? there are specific changes that you want to implement around it. So the plan looks at how you're going to handle compensation. What are we paying for? How are we going to do difference in operation? We have to develop the new policies that you see in the left-hand column on this particular chart to be able to respond to the types of things that we're focused on in each of these areas. So prevention is designed to keep employees well. Remember the bell curve? We showed the difference between the prepared and the unprepared. And cleaning and hygiene are the biggest areas that we can do to make a difference. Limiting parents coming in or visitors, encouraging hand washing, and we can't say hand washing enough in this process. The cough etiquette that we've all been taught, even air circulations. We've seen less developed countries do significantly better because of bringing in fresh air into these areas, and instead of an absolutely closed environment. Remember the example of the SARS airplane and that we showed you earlier. The more that we're all breathing the same air becomes a problem. And there may come a time when you want people to have masks on in a classroom. The social distancing, staggering lunch hours, spreading things out. What are the alternatives to how we traditionally teach? You've got to protect yourself. And when you look at this, you see these types of things, and these are the same things that we want to train our young people on as we look at it. The washing your hands thoroughly with water and soap, look at the 15 to 20 seconds. We've all seen people that wash their hands, literally turn it on, run their hands through it, rub them, cut the water off, and they're done in a matter of 2 or 3 seconds associated with it. The re-singing of the birthday song is a fallback process to be able to lengthen that using the soap. We want to avoid sharing. We want to keep distancing here. And if we're seeing symptoms of fever or respiratory infection, we immediately want them to be referred to their doctor and get a certificate before they return to school. Recognizing that if we do reach epidemic and pandemic levels, it may be very difficult to access normal medical care. If we had hundreds of people in Atlanta with these types of symptoms, it would overwhelm the emergency rooms in Atlanta, just a few hundred people. But think about now if suddenly 10% of the population of Atlanta became infected. There are over 6 million people in metropolitan Atlanta. That would mean hundreds of thousands of people attempting to get assistance here, and the system would break at that point in time, let alone if suddenly 30, 40% of the population gets sick. So this is an area that you've got to monitor closely from the imminent through each of the other phases to escalate your level of response to be able to handle in these areas. You've got to then be able to talk about what's going forward. You've got to disseminate information about absenteeism. Where will people go to get that information? The school website, the intranet, school email alerts. You may need to set up a call center to go there, particularly if you're closing the school or if you're now reopening the school. Thinking about how parents will become aware, what preconditions do you want to have in place, and then clearly established not only who you're sending the message to, but when you're going to send it to them, and establishing that messaging in advance. You don't want to wait until the event to try to establish that process. Now, the monitoring is the absolute key here. It's what's happening in your community closest to your school. The fact that there's an outbreak in California, that's a data point for you, but we're not going to change the activities in our schools here in the state of Georgia. Suddenly it's in Texas. Okay, well, that's closer. Maybe it's in Alabama. Maybe it's in South Carolina. Maybe it's in Florida. Maybe it's in Tennessee. Well, now when we start to see it around the area, that would become a concern that we need to start to escalate it. When you start hearing the reports within the state, within the county, within the community, within the city, those are the ones where we start to see the escalation. Now, what we also have to do is to look at what are the derivative measurable tools that we can use. Business closures, closures of other schools, when you certainly start to see people talking about an increase in banking transactions, because cash will be very important. You may see a bank close and only have their ATMs available. These could all be areas that you'd be looking for. Shortage of medicine, fuel or food shortages. That was a tongue twister for me today, too. I must need to get that other cup of coffee as we're going forward. So you want to start tracking these and determine who within your organization is going to be tracking and what they're going to be tracking in those areas. Now, you'd start to divide the monitoring and the triggers, and I gave you a couple of samples up here on the screen. These need to be rewritten just for your school and looking at your areas, but you see the imminent, the severity levels that are coming up with the guarded, the elevated, and then the severe as you're going forward, and then even monitoring in a post-pandemic level and where you would go, what you would look for, and who is responsible to get that done. The monitoring and infection control, we start to break that down as you look at steps for the pre-action stage, the imminent stage, and then the onset, and you see different responsibilities being tied to different groups. These are charts that came out of a financial institution that we were working with to give that clarity. But you would want to develop the same types of lists and charts as you think about your organization. Similarly, looking at critical vendors in the pre-action and onset phases, what is who are they, who's monitoring, what are the steps, looking at your HR and operational policies associated with those in each of these areas and coming as we carry forward. And then thinking about your communications. What are you going to be saying in the pre-action? What are you saying in the imminent? Who's responsible? What are the decision points? How do you tie those all together? Spelling those things out become absolutely critical. So as we move from that, then we have to test, train, and maintain our plans. You need to be updating your plan once every 12 months, and then notice all the things that you need to be looking at, confirming your communications protocols, validating the assumptions, because every time we see a new emerging disease or a mutation in an existing disease, validating those specifically, ensuring that you have the contingencies in place or the procedures, confirming that the individuals named as alternates have been cross-trained. So if I become ill, who's going to take my place? What are they going to do? Ensure that we have a reassigning of workspace, that's social distancing. We may want to pull those chairs in the classrooms as far apart, maybe as we possibly can. Maybe we have part of the students come in the morning and another part in the afternoon. How do we spread this so that we can minimize those exposures and then implement and evaluate our timeliness of implementation at each pandemic stage? So when we think about it, there's a lot of specificity that comes into play to deal with these areas. I want you to think about this now instead of, wait a minute, there's now a pandemic, what do we do? Then you lose the luxury here. We talked very early on about our plans provide us a time machine. They buy us time when it's most critical for us to look in this area. When we think about communicable illness, this is one of the key elements that we need to be focused on to deal with that. You are more likely to have a communicable illness outbreak in your school than you are to have an active shooter. And you're more likely to have it by multiple orders of magnitude greater than an active shooter in your school. Think about everything that you've done within your school to focus on armed intruder. Then compare it to the level of effort that you have implemented to think about communicable illness in your school. Do you see a discrepancy? If you don't, that's great. If you do, then you now need to start to address it, because this is a much more likely event, and you're now on notice with the forecast from BioRadar that they're anticipating a return of the swine flu in the fall at pandemic levels globally. And as you feel that in place, we then have the summer to prepare our schools. We have the summer to put our policies in place. We have the summer to put our stockpiling of supplies in place. The last time the swine flu came through, we had a shortage of N95 masks. We had a shortage of the latex gloves. We had a shortage of cleaning supplies. Think about this now and not wait until that event comes in. So as you go forward, you just have the same types of training, because we do one level of training at the pandemic stage. When it's imminent, we would escalate the training specifically at that point, and then finally when it's in that guarded level, when it's here, there's still time for some training there. But we can't do it all at the last minute. You need to be putting that in place now in order to have those elements together. And then you want to then make sure that you're updating your plans. Just with all of our plans, we have a maintenance schedule. We generally recommend, for example, call lists are updated quarterly. Other aspects would be updated throughout the year. Thinking about every time you do a test or an exercise, what revisions to your plan do you need to put into place? What needs to change within your organization? And having those elements put together become a key difference. So with the emphasis that we've been placing on preparedness and trying to simplify that in all our schools, it comes to a point where communicable illness is certainly a high impact, potentially catastrophic one. And we know that it's not rare, it's very possible. You now have forecasts from informed parties that the likelihood of a pandemic occurring in the fall of this year is high. So that gives us notice, and we need to be dealing with it. We had a slide earlier that talked about this is a governance responsibility of your board. I think this is an area that you need to think about, and this webinar today is being recorded. It's available on demand at firestorm.com/GISA. And I would encourage you to have others in your school listen to it, think about the information, and then start a conversation in your school. If you need some assistance, give us a call. We certainly are glad to help. But this is an area that needs to become a priority for you now, not when the pandemic is announced as occurring. So what do we need to do? Make hand washing a habit and a healthy habit every day, multiple times during the day. And as we see these types of areas going up, we want to see an escalation. So everything that your mom taught you when you were a child about washing your hands and covering your face when you cough, we're seeing that come to fruition when we look at these types of communicable illnesses at each step along the way. If you'd like to have an update of where you are in terms of your preparedness plan, Firestorm, with its affiliation with GISA, is offering, again, to do the school preparedness self-assessment. It's looking at the 8 dimensions and some 40-plus data points across those 8 dimensions in total, and helping you to understand where you are relative to standards and best practices. There'll be some questions in that preparedness assessment around communicable illness. Certainly is an area for you to think about, because that's an area that's important that we all focus on in our schools. So if you contact us requesting it, please be sure to mention the GISA so that there will be no charge to you or your school to have the assessment done. We'd like to thank the Georgia Independent School Association for everything that they're doing to help our schools across the state of Georgia. I think we clearly have seen where they've made a difference, and I think that there's an opportunity here for all of us to work together to help lower the risk that our faculty and students face, particularly from communicable illness. So, Candy, as we wrap up today, is there any comment that you want to share with the group about the GISA or upcoming events that we all need to be aware of today?
I just want to thank you, Jim, and your staff, and also to say that, you know, some of our schools looked at some of these issues several years ago when the swine flu, and this whole idea of being prepared if you need to work from home and have your students work from home. I'm glad you reiterated all that. And this was a great webinar, and I'm going to make it a point that we make sure we get this information out to all 160 plus of our schools, because you don't think about it until you need it, as you've said before. So thank you so much.
Oh, I appreciate it, Kenny, and thanks for all that you do, and I think the coordination of information. We all, as a group, all 160 of us from a school perspective, we should have a mutual aid agreement that we're going to help each other, because what happens in our schools spreads from one to another, whether it's violence or communicable illness, as we carry forward. We'd like to thank GISA and Candy for underwriting this Crisis Coach webinar series. If you would like to watch any of the recorded webinars, again, you can go to firestorm.com/GISA, or you can register for future webinars. We do one a month, and it's an opportunity for you to continue to grow in this aspect of your career in working. If you have questions, contact us at webinars@firestorm.com, or you can call us at 800-321-2219. Thank you for investing about 45 minutes with us today to talk about communicable illness and what it can mean in our schools. And thank you specifically for everything you're doing to make our students safe. Thanks, everyone, and have a great day. Candy, I look forward to talking to you in the future. We did have some that came in. We're not going to have time to answer them all live today, but we'll try to reach out to everyone on the call.
Thank you, Jim.
All. Have a great day.
Thank you.
Goodbye.